Awesome. I guess we can go ahead and get started. Hi, everyone. This is Danny. I'll be hosting this session, Making the Right Moves, Situational Judgment Test Workshop with Dr. Emil Chuck. So just to give a quick introduction to our session, Dr. Chuck brings over 15 years of experience in health professions advising and admissions to his role as Director of Advising Services for the Health Professional Student Association. He has a background that includes serving as the Director of Admissions and Recruitment at Rosalind Franklin University of Medicine and Science and Director of Admissions at the School of Dental Medicine at Case Western Reserve. Dr. Chuck is a seasoned expert in guiding aspiring healthcare professionals, and he's committed to supporting the next generation of diverse healthcare providers, helping them gain confidence and become successful members of the interprofessional healthcare community. So please take a moment to welcome Dr. Chuck. Dr. Chuck, thank you for coming and joining the session.
Danny, thank you so much. Lexi, also thank you for having us, and to all the members of the NPHC team, thank you for having my workshop be available to you. Now, I am going to hope that I can do this transition over, and please let me know in the chat box. I just want to make sure there's a question in terms of where you're coming from. If you're joining us on Zoom or joining us on YouTube or any of the other streaming platforms that are there. So let's see if this works. Can you see my slides? Can you see me in the slides too? Is that all right? I hope that's okay for everybody. I have my other monitor is just to my left. So if I'm looking that way, please forgive me along those lines. So thank you for having me again. This is our online workshop for making the right moves to master situational judgment tests and also building decision-making skills for your life and a health professional career. The Health Professional Student Association is the parent organization involved with the establishment of the Student Doctor Network, a number of free resources, including our very well-known forums that have been around for 25 years. So we predate a lot of resources that have since been developed on the internet since then. So we will be celebrating our 25th year anniversary and actually relatively soon and all throughout the remainder of the calendar year. Just very briefly, we're going to run through this slide deck really fast, just because I know that this session is being recorded. I encourage you to come back later and access this presentation and go through some of the slides if things are really quick for you, because I want to make sure that you get a chance to really have a lot of the information sink in if you are interested. I'm going to just very basically go through situational judgment tests in the medical school admissions cycle, as well as many other health professions programs. I'll give you a little bit of a simple breakdown of the anatomy, as it were, of situational judgment test scenarios, and also address your questions if you have about what would constitute a right or wrong answer, even though there are not really any right or wrong answers in these situational judgment tests. I think many of you will be excited to know there will be a few practice questions that I've designed specifically for this workshop. I will admit, how I want to manage this is that if you have questions right now about situational judgment tests, please put them, if you're on Zoom, in the Q&A box. If you are joining us otherwise, please put them in comments. But when we go into practice, we will be using the chat room. And so if you're on Zoom, the chat room is really going to be where we're going to do a lot of our practice versus your questions and answers. So I just want to make sure that you know that's how I would prefer us navigating this presentation. Situational judgment tests. If you're wondering, we at HPSA, we have a research background. And one of the things that I've been trying to do in my role is really revive a little bit more of our research program and get a sense of what the experience is like for individuals who are in the midst of applying to various programs. And one of the more recent surveys that we just did basically asked the question, what types of questions did you encounter, regardless of whatever format that you happen to have experienced, whether it's traditional interviews, multiple mini interviews, panel interviews, group interviews, whatever have you. And as you can kind of see from this very, this pulse graph, as it were, this pulse survey, you can see that situational or ethical oriented questions pretty much were as frequent as personal questions to a lot of the people who responded to our survey. So needless to say, these are among the more important and expected set of questions you should encounter in your health professional application journey, whether it's med school, PA, dental, whatever else have you. So this is a really important topic that goes beyond just the tests. It's also about how well you can do on interview questions where situational judgment is in play. This is a really busy slide, but it summarizes some results from a systematic review looking at the elements of an application process. And for those of us in admissions, we really want to find where data exists, which gives us predictability of your performance in a health professional program, in our graduate program. And the two main ones that really pop out are situational judgment tests and multiple mini interviews, which are actually two of the same type of assessment. And what makes it really nice is that there's been shown to be good validity in the types of scoring that one gets with the type of outcomes that you would get on the job in a classroom setting or so forth. And so situational judgment tests and multiple mini interviews are, and have been for the last 10 years anyway, much more accepted as part of the application process to many different schools. And quite frankly, it's one of many different goals that situational judgment tests have. If you saw from the last slide and this slide, these are goals that the AAMC PREview team articulated in a recent publication that basically says the reason why they developed their situational judgment test was to help with assessing professional competencies, signaling that these professional competencies are very important, and also enable holistic review, application review, holistically in a high volume context. So basically it's allowing admissions processes to look at a very large volume of applications and begin what I will consider is the first pass, or at least one or a multiple level of sort of cuts, so that you get to a reasonable pool that you would want to interview a little bit later on. That's the goal, and that's usually how most situational judgment tests are intended. In the United States, situational judgment tests actually have existed for a very long period of time. And the ones that you will hear very, very frequently in health professions education are objective structured clinical exams, or OSCEs. If you go and talk to anybody in med school, dental school, pharmacy programs, PA, dental hygiene, whatever have you, they will talk about having to take OSCE exams for licensure. So OSCE is a situational judgment test. It just has a very strong component for clinical professionalism and clinical skills attached to it. Multiple mini interviews are a derivation of OSCEs. It's just that they take the clinical education and clinical skills part out of the process. So we're looking at more communication skills, more ethics related type thinking, more teamwork thinking, all of those sorts of things. And we'll go to those competencies. That's a little bit of a later slide. So multiple mini interviews have been around probably for about 15 or so years, and an online delivery version of a multiple mini interview was developed in Canada by a group of faculty at McMaster University. They formed a company which is now known as Acuity Insights. And so they published a number of different papers looking at the validity of Casper, which is their online multiple mini interview platform. Currently, if you look online, there's about 37 or so schools that require taking Casper, and that's just for the medical school part. We'll get to a lot of other professions a little bit later on. The AAMC, in the meantime, over the last 10 or so years, has been developing its own situational judgment test. And right now, only 9 schools out of the 100 some odd AMCAS schools are requiring taking the preview exam. However, as you look on my slide here, there's over 30 schools that have said they would love to have preview scores. It's not required for you, but if you wind up taking it, they'll use that data for research purposes. What that actually means still remains to be seen, but that's something to kind of keep in mind for you about what the current landscape looks like in terms of whether you, quote, have to take one or the other of these exams. We'll go into Cura Talent. That's a different variation of situational judgment tests later on. But when I first started this slide, it was about a couple of years ago when Preview was still in a pilot phase. And last year was the first year where it went into a full implementation phase. So last year, I basically did a back of a napkin calculation to kind of figure out which schools are actually going to have their in-state applicants take both exams. And what I wound up doing is making this calculation based on public AMCAS data. And the number looked to be about 11,000 people were going to be taking the preview exam and the Casper exam last cycle. That's just an estimate. And that wound up to be about 20% of the entire AMCAS application pool. Well, what we found out earlier this year was about 20,000 people took preview. So that's double the number than was estimated for taking both exams from my napkin calculation here. So a lot of people are getting messages that AAMC preview is really important and you should take it, even though it's only required by a handful of schools. So I just want to make sure that you know what's going on regarding that. Now, as I mentioned, Casper's been around for at least a decade, and it has been so widely accepted in Canada that practically any health profession that you are pursuing, any admission to those types of programs requires you to take the situational judgment test, at least Casper. And all of these types of programs in Canada, there's at least one of those programs that will require you to take Casper. That's a pretty extensive list. Needless to say, in the United States, it's not as long, but you can kind of see that medicine is not the only player that uses Casper. A lot of other health professions also use it. And it's just that, there's just more attention focused on it because AAMC developed its own preview exam. What you also may not be aware of is that many graduate and residency programs are also tinkering with Casper as part of the residency selection process. So in addition to your other board scores that you have to take, there's a handful of schools or programs in residency that want you to take Casper as part of their process, their vetting process to choose candidates that they want to interview for their residency program. So be aware that you may find a way to avoid a situational judgment test to get into medical school, but chances are that in 3 or 4 years, you may wind up having to take a situational judgment test like Casper to get into residency. So be aware that this is an ever-moving target and things may change over time, especially while you're in school. So even more interesting is the fact that I'm starting to see Casper being required for undergraduate entry. So for programs that require entry into BA, MD tracks or nursing tracks or so for an undergraduate pre-professional guaranteed admission track, there are some programs that are starting to dabble with playing with Casper or some situational judgment test as a condition of entry and participation into those programs. So this is something that is going to be spreading if we're not too careful, and it doesn't matter one way or another what we all think, of course, but just be aware that situational judgment is very, very important. And a lot of people are taking these assessments very seriously as part of your selection and training. Now, I'm going to go through these slides super quick, but I just want to highlight some things because if you're interested in these tests, you ought to go to the testing websites and get the information directly from the people who make the tests. Acuity Insights Casper exam is very well known for being an open-ended exam that takes about 1.5 hours. It involves 14 scenarios and it involves audiovisual as well as text-based type questions. In contrast, the AAMC preview exam is designed more as a multiple choice exam. It is one where you have to basically identify how effective or ineffective certain responses are. You have 35 scenarios, 75 minutes, and 186 multiple choice questions to complete during that period of time. So those are two very different tests that you need to be aware of, but they are testing you in elements of your situational judgment. They are looking at competencies, and there is stark overlap between both of these major exams. And I do sort of a gross comparison, just highlighting by color which competencies are very similar to each other. One of the things that's really interesting to note is because of the formatting, because it's an open response for Casper, you have the ability, or one has the ability to assess your problem-solving process much better than if you did a multiple choice test, which is what preview is. So problem-solving sticks out in terms of one of the competencies that Casper assesses that preview does not. And that's an interesting design difference between one and the other exam. If you want to really know a lot more about it, we have been doing we've completed 2 surveys of the situational judgment test experience among people who are applying to get into mostly medical school over the last 2 cycles. We have a handful of people who are applying to many other programs, but I understand most of the people who are very responsive to Student Doctor Network tend to be on the pre-med side of things. So please, no offense to anybody who's thinking about any other career path. But if you're interested, please, snap this code or get in contact with us, and you can get access to our executive summary of our most recent survey, which I'm going to summarize really quickly here. So we did an initial survey back in 2022, back when it was still a pilot program. Most of the test dates were done during the summer, so most people were taking the exam at home on their laptop as instructed by AAMC or by Casper. As mentioned for Casper, there were other fields that were also represented in our survey pool, but predominantly most people were premed, identified as premed. For the handful of students that actually took both Casper and Preview, we looked to compare the scoring of how well they claimed they did on Casper and Preview by quartile and sort of line up to see, is there any correlation between their performance on one test or the other? Turns out that the answer is no. They are two different tests and they test for different things. You will see that for the Casper scores, if you do the sum across each quartile across each row, you have roughly the same number of people per quartile, which is nice to see statistically speaking. Whereas if you sum the numbers by column, for Preview, you see that there is a remarkable skew towards the higher quartiles among those who take Preview. So just letting you know, if you think you did really well on one situational judgment test, it doesn't guarantee you will do very well on the other. And that's one of the things that frustrates many people who take these situational judgment tests. So last year in 2023, we also looked very closely at the way things are being tested. And just summarizing here, problem solving, which is what competency that was tested in Casper, seemed to have a nice correlation in our sample with the CAR scores on the MCAT, which is again a situational, it's not a situational judgment test, it's a critical thinking test, which it's really interesting to see that association. This has not been published before in terms of in any of the other surveys that have been out there. Preview scores, some places say that if you have more experience in an academic medical setting, you tend to do better. And who would tend to do better? In general, those who are coming out from post-bac and graduate programs. You can kind of see that there's various value assigned to these scores based on whether one actually gets interviewed after having done a situational judgment test or not get interviewed based on their situational judgment test score or whatever that perception is. It turns out, at least for this past year, if you got interviewed and had a high score, you felt that SJTs were very valuable. If you got interviewed but had a low SJT score, you felt that it had no value whatsoever. And when we looked at our survey and tried to see, well, at the time when we did our survey, did you get invited to interview? So an early step to help whittle down in a high volume context applications. Did your scores on these SJTs have some predictability on your potential to get an invitation to interview? And the answer right now for this, at least what it looks like right now, is that there is no real strong correlation. So regardless of what you would think logically about it, it does not appear that the medical schools that we were able to survey, given our subjects that responded to our survey, were taking these situational judgment test scores so seriously with regards to selecting people for interviews. So if you got a low quartile, a low score, do not get upset. It may come later on when the research comes in that there is justification to sort of screen out and eliminate, say, the bottom two quartiles or something. But needless to say, there's no evidence, at least based on the medical school application process, that this is actually happening. Whether this happens in other professions remains to be seen, and we want more data to really show that that actually is happening, because that's the way these tests are designed. In both surveys, we identified challenges on taking the test that you need to anticipate. Over the decade, many people will talk about Casper and the challenge of managing your time and typing your responses. In Preview, the last couple of years, we hear a lot of people talking about the proctoring and the connection issues that are involved and challenges that are involved with taking the Preview exam. And there's a new video, or a relatively new video, on the Preview site that really shows what to expect in that sense, which it wasn't existing before. Everyone knows we all would love to have more practice questions. Casper has an unscored test. Preview's released a second practice test on its own. We have had free questions available on our forum, our SJT Casper forum. So you could get practice. There's a lot of different questions that are out there. There's loads of MMI style questions that are on the internet that you can find. But the big challenge that everyone has is exactly, we need more transparency. How do these scores affect admissions decisions? And at this point, we don't have any definitive insight into that. And so we're hoping that in the future we can, and that will help all of us in terms of advising you on what you should do should you wind up with a low SJT score. As it currently stands, do not be dissuaded, just keep going forward and we'll do what we can. So what do SJTs really assess? Well, they really assess your decision-making process under certain situations. And so there's a science about how you make decisions. I'm not going to go into all the economics, but let's just start with a simple question here. I'm going to start off with the situation. You can write your answer and just type the word stay or take in the chat box. But as you kind of see here, you can be in a situation where you're on a tight schedule for a volunteering opportunity. Traffic is starting to get slow because there's an accident ahead of you. Your GPS maps program suggests a faster route that shaves off 20 minutes from your arrival time and avoids the accident. But your peer says, no, that detour takes us through the ghetto. I don't want to get shot. So very quickly, for those of you who are online, just type in, what would you do? Would you stay the course to keep going into the accident, or would you take the detour as instructed by the computer? I'm going to give you guys about 10 seconds for those of you to just type into the chat, stay or take. Again, we're not doing this as a survey. There's no correct answer one way or another. I just want to get your flash response to this scenario. And for those of you who are going to be going by this on a replay, make sure you pause, give yourself some time. But I really am not asking you to just do a lot of time. Just type in your flash response, your reflex response to this. Now, as many of you are wrapping up and typing in your answers, I want to highlight for you, this is not the way you should be approaching situational judgment tests. As much as we really want to have that impulsive answer, we really want you to be more thorough when it comes to looking at a situation and sort of seeing nuances that exist here. And so I know I did the improper thing and forced you guys to do an answer, which is not the way you should be approaching your situational judgment test. But that's one of the things that people tend to do, is they just act on their impulses and they go. We want you to be more methodological. Like, for example, who's driving the car? Would it make a difference if you were the driver or your partner was the driver of the car? I would think that if their partner was driving and their partner says that detour takes us through the ghetto, I don't want to get shot, you actually don't have a choice. Whereas obviously, if you're driving, you get to have the power to make that choice. If you're going to take the detour, you're going to stay on course. Other things to kind of note, obviously, we're all presuming you're probably driving on a freeway, on an interstate or something. What if you're off on the main roads and you happen to take some detours? If you're familiar with the area, do you know of better detours that are out there, and so forth from there? And finally, one other situation, maybe you're not driving at all. Maybe you're riding an Uber, or you're riding a bus or a van or whatever else have you. So somebody else is driving and you're making this comment sort of to the side and not really impacting the driver's decisions. But you obviously have you have to field some sort of visceral response that your partner actually is having here. So I want to just point this out, that in situational judgment tests, you are given, and you should anticipate, follow-up questions that really tease your thoughts and these extra sort of situational, observational aspects of this scenario that really give us a better sense of how you make decisions. Most of us who make decisions, when we come and make a decision, we are really concerned with 4 major things. And for those of you who are familiar with philosophy or sociology, this is the Maslow hierarchy of needs. Everyone wants to make decisions such that their physiological needs are met, that you have enough food, enough water, enough sleep. Everyone wants to make decisions and should be making decisions that make them safer or be in a safer environment. People usually like to make decisions because they have concern about their friends, their family, or maintaining strong relationships with intimate friends or other individuals. And finally, sometimes you make decisions to reaffirm who you are and actualize, what your status is, and make sure that you know that you have exercised agency or power. So when most people make any sort of decision, one of these 4, or a combination of these 4 general factors, is in play when it comes to making a decision one way or another. Now, there's a lot more of a process that's involved with making a decision. And this is just a very simple middle school level decision-making model that I found on the internet. that pretty much walks you through the simple steps of identifying a decision, thinking about options to respond, figuring out consequences and possible outcomes, choosing among those the best decision that you possibly have with the information that you have. And then once you see the consequences, reflect on them and see if this was the right thing to do, or you could have come up with a better solution one way or another. What I will mention to you is based on the designs of these two situational judgment tests that are in play here, the Casper assessment with its open-ended responses gives opportunities to really go and evaluate your steps to 2 through 5, that entire process of decision-making, since problem solving is a competency that's designed in the test. Preview is much more designed on looking at effective or ineffective outcomes or possible responses to a situation. So they're asking you much more on the reflective piece, so the last step in that process. So again, they're two different tests. They test two different ways of you and how you make decisions. And that's something that you should think about and carry forward with you as you're seeing the differences between the tests and maybe why you do better on one versus the other. As the example previously showed, we really want you to understand it's not just how you would do, but how you recognize other players in the situation. Who has authority or power or agency? Or does everyone have equal standing? Is there someone you appeal to who's in the picture or who's outside the picture? Those are things that are just among the different strategies that you should be able to recognize given a scenario and, of course, quote, needing more information. Finally, what everyone recognizes is that, yeah, you can go with the Maslow hierarchy of needs, but there are rules. There is an etiquette that many of you are expected to follow. And for most of us who are going into health professional fields, we're very much interested in revealing our competency in medical or professional ethics, our academic integrity, our understanding of student codes of conduct, as well as an understanding of equity, justice, and cultural competency. So these are all areas that come up very frequently in most of these situational judgment tests. So I'm going to kind of walk you through a number of situations. I'm going to basically blow by this very, very quickly for you guys, just because I know I want to get to your questions very quickly. And there's another interactive section coming up after this. So I'm going to basically write for you these MMI style questions that you could use for Casper, but Casper obviously is a standardized test and it goes through additional sort of review before it's part of their exam. But MMI depends on who writes those questions for you. So I'm just going to give you some situations and also just sort of a thinking process, just some suggested questions as you kind of observe what's going on in each scenario. So first of all, I'm just going to stop really quickly and show you one such scenario here where you're in a study group, but you're taking a break. One of your peers recognizes a female classmate who's probably not in your group from a few sexually suggestive clips that they have discovered on the internet. Some videos seem to have been recorded in on-campus study rooms and in various homes. Well, your peer comments, "Is that really our classmate? And was that video, do you recognize that as Professor X's house?" So that's the end of the scenario. And and normally for Casper, you get usually 3 questions to respond, whether it's in an oral format or it's in typewritten format. But I'm having you go through a process of really thinking through and going through what is essentially that flow chart from earlier about your decision-making process so that you can possibly be able to better articulate what the situation is if you are asked about it a little bit later on. So is there a similar situation that you've observed based on this scenario? Do you identify other players who has power, who has the ability to make change or make any rules or rulings? What are the rules that are in play? What are some plausible explanations for what you see? In some cases, what are consequences if you don't actually do anything? And if you did do something, what are some actions, the limits that you have in taking action and the consequences? So those 6 questions are going to still remain for the other scenarios that are basically, I'm going to flash at you very quickly. So this is one scenario. And in our this is a second scenario. When I normally do workshops and we're in person, we get more time to discuss. So I apologize ahead of time for not giving you any time to really discuss them. But as you read some of the scenarios, you can kind of start to see some of the dilemmas that come into play, especially when it comes to rules that you have to follow versus other things that you feel very, very, very strongly about, especially with morality or whatever stance that you viscerally have for a situation such as the one in this scenario. This is a third one. This one I hope might be familiar with many of you in light of COVID. And I don't know whether many of you have even worked with such situations where someone is unvaccinated, but wants to do clinical rotation. So what do you do? So we're going to go through all of that process again. And if you get a chance to sort of review this on a replay, please go through this and go through the thinking process that I pretty much outlined here, among any other strategy that you ultimately find on the internet about how you address these types of scenarios. Here's another one that I think many people who have had clinical experience will recognize. It is certainly if you are asked to find a caregiver that is more aligned with the patient's needs, what do you do? How do you manage that and adjust for it? So let's just go really quickly to the absolute endpoint here. The Acuity Insights team most recently surveyed their Casper raters and asked them what things they looked for that led to higher scores in terms of the response, in responding to students' responses to certain scenarios. And what they found is that these Casper raters, and I'll also extend to MMI raters, are probably looking for the same thing. They want to see how candidates understand and interpret social dilemmas in their nuanced or complex ways, thoughtfully justify their approach to a situation, propose novel or creative solutions or ideas, apply critical thinking to the situations requiring a professional approach, exercise and demonstrate sound professional or ethical judgment, consider multiple perspectives, so it's not just your situation, but understand plausibly why would the other person behave the way that they are, or ask for things the way that they are. Reflexively use your own examples to demonstrate key aspects of social intelligence or professionalism. And with that information, that is what many of the raters claim they use to really score a scenario closer to a 9, which is the highest possible score for each scenario response. So again, many of these things have been articulated in a number of articles that we've published, and many other people have talked about over the years about Casper. So please don't hesitate to use the free resources, the free articles that are out there about preparing for Casper or MMI. That will really help you. And I mean, I have my own variation, which is, remember to structure your answers in stairs. Situation, task, action or alternative, impact, and reflection. That's just stuff that you'll learn. And hopefully it's ways to help you organize your thoughts. Now, what makes this a little bit interesting is the preview exam is very different. It actually asks you to identify and rate various responses to scenarios as either being highly effective or highly ineffective on a 4-point scale. A similar scenario, a similar SJT, situational judgment test that exists, is also available where you get to rank and sort all the various responses that you get as most effective to least effective. And I think that was what the test takers were taking as its design. So I am going to show you a number of situations, and I want you to use I want you to type in your answers in the form of just the responses 1, 2, or 3 in whatever order that you want to, from most effective to least effective. So let me show you an example. I'll give you about 5 seconds to kind of read through this scenario. So this is a scenario that basically you have a conflict, and we want to know from your standpoint of the following 3 responses, type in order the most effective to least effective response of the 3. So I'm going to give you about 10 seconds to look at those 3 responses and just type in the chat your order. So you could say 1, 2, 3, 2, 3, 1, 3, 2, 1, whatever it is. I just take the time right now. We've got 5 of these to go through just to see how you do. So we'll start off with this one. And I'll give you guys about 10 seconds to sort of run through and just sort of type in what order you think are in order, the most effective response to least effective response. And I want it to be said, there's no, don't restrict yourself. Again, I'm not intending there to be an absolute correct answer. I just want to see how you think. And I want to just get a sense from everybody where you're going. And you got a chance to see how everybody else is thinking too. All right, so I hope you got an idea of what these exercises are about. So that's the first of 5. Let's go to the second one over here. This is one that is a modified MMI question that I found on the internet during the COVID era. I made a couple of changes to it, so it's not exactly the same. I want you to give me your ideas of the following 3 responses from most effective to least effective. So you got 10 seconds. All right, I want to make sure everyone is typing in their answers and everyone can see it in the chat. Don't, again, we're not grading you. You're not going to, you're not going to be penalized or punished for anything that you respond. We understand this is practice. All right, let me go to the third scenario then really quickly. Let me see if there we go. So this is a third scenario. It's also a little clinical. This is actually a modified scenario from the first preview practice exam. So you actually can get an opportunity to look at the answer key to the possible outcomes that we have here. Now, on preview, you get like 8 or 9 different scenarios, and you're not going to rank them. But I think one of the key elements that makes the preview exam difficult is sort of nuancing whether something is effective or ineffective or very ineffective. So let me give you a little bit of a chance to do this. So we're only going to pick 3 of those 9 different scenarios and just rank them in your opinion on most effective to least effective. And if you're going to do this on the replay, do your answer and then go back into the answer key for the first preview sample test. Look for question number 4 and also read the answer key and the rationale presented by the individuals who designed the scenario. Let's go to scenario number 4. Again, I have 5 of these. So let me give you a little bit of time. Also, rank the same thing, most effective to least effective. All right, I will wrap this up. This is, I believe, our last scenario. This is situation number 5. And again, I'm interested in your thoughts about most effective to least effective of these 3 responses. And again, I know I would love to have more time, but I, again, want to make sure I address your questions. And I know I'm creeping a little bit into a 5-minute Q&A period here. So again, thank you guys for at least participating in some of the questions. I recently wrote an article just outlining all the resources that Student.net has compiled over the last few years, actually many, many years, that will help you throughout your application process. So please don't hesitate to go back to our archives of our articles and read and be informed about a lot of things about many of the resources that are available to you to help you for a future career in the health professional field, medicine, dentistry, vet medicine, whatever. In terms of how you prepare for situational judgment tests, I think in the same way for the MCAT, where actually coursework or or some other background before you actually formally prepare is important. We surveyed our individuals for our SJT experience survey, and they all pretty much say that your life experiences play an important role in doing well on these situational judgment tests. So you can kind of see that there. Coursework also winds up being very important. And interestingly, of course, this is the non-science coursework. The courses that you don't have to really delve into very seriously for the MCAT, they pop up here. So humanities, which would include ethics and philosophy, come up. Sociology, research, as well as possible research or capstone opportunities. Free resources that are available, I've mentioned the SJT forum on Student Doctor Network. The other ranking SJT is done by the UK, and their gateway exam to getting into medical school in the UK, Australia, and New Zealand. It's called the UCAT over there, and they have quite an extensive array of resources that are available for free if you want to just try a different format of an SJT. But be aware that a lot of people over social media have had and recorded videos on how to do well, especially on Casper, and they so-called crushed the exam. I don't know how they know that. And there are actually some peer-reviewed programs. And I would also say you could possibly see if you can use chatbots, but just be very cautious since that technology is still very, very new. This is all part of a program that we've been doing and I've been involved with, which is developing the Becoming a Student Doctor course, which is not your course that's typically suited for doing well on the application process, but it really is meant for, sort of seeing the landscape over the next 10 years as you get into the early stages of your education and training and how schools and programs are developing approaches to address some of the challenges that you will be facing over the next 10 years. Finally, one more thing for anybody here, I may leave this slide up a little bit longer. We also do have a student advisory council, and we are currently soliciting for individuals who'd like to volunteer over the next year. So if you are interested, this is our email address. We would love to have a letter of interest and maybe a brief resume, just sort of letting us know why you'd be interested in helping guide and steer any initiatives that will help future healthcare professionals through the Student Advisory Council. So I appreciate all of your help about this. And some ethical dilemmas are just much more important than others, but I really hope you appreciate that this is going to be something that you're going to be dealing with the rest of your life, one way or another. So thank you guys so much for having me here. And I'm here to take your questions for the next 5 to 10 minutes then.
Awesome. Thank you, Dr. Chuck. Okay, let's go into the first question. It's a bit of a bigger question. The first question are, why are situational judgment tests becoming more and more popular? And the potential new requirements for medical school, are interviews no longer cutting it?
So I don't think it's, quote, becoming more and more popular. I do think that there is an acknowledgement that soft skills, interpersonal communication is something that has been under-assessed when it comes to an application process. And so, as I mentioned before, SJTs have always been there. I think just more and more people realize that as we go into a world where, we need to have some objective measure or some predictable measure of how well you would be prepared for a career path in the health professions, these situational judgment tests are important. Again, you will be immersed in situational judgment tests. OSCEs are going to be you're going to have to face OSCEs for all of your training for licensure or to retain your license or to be in a good residency position. So don't be of the attitude that this is an inconvenience. It is an inconvenience, but on the other hand, it's always been there. And I think we're just asking people to understand that this is going to be part of your professional training. So it's something to embrace regardless of whatever happens. And it hopefully helps us understand if you had difficulties with your academics, this is another way to give us an insight into how well of an actual caring, empathetic healthcare practitioner you will be.
Yeah, I think that is really important, that it's going to be like any aspect of your career, and that a lot of students don't know. I didn't know that you would have to do it possibly for residency. So it's really important to learn. I think we have another question that came in. How can graders decide that an answer is better than another?
So I think in terms of, what people look for in terms of how you grade answers, I think you got a little bit of insight for Casper anyway from that survey results slide. So you get an idea that we're not necessarily looking at what your answer is. We are looking at how you approached the answer, how you got to where you're going to say, where an approach that you have. Yes, we understand there are nuances, but don't be distracted by the nuances that you think should be included. Some are very much important, but you cannot completely distract yourself from there. We want to know how you think in terms of making a decision for an action. And that's one of the more important things to really convey in a lot of those answers. Again, read those various articles that we have published on student.net for a number of years from various other individuals and experts that have talked about Casper and MMIs.
Yeah, I think that's also like a very important thing to learn as you're going through this preview and Casper journey. I have a question personally. What are some common challenges that students often face when preparing for assessments? Because for preparing for these assessments specifically, I know I struggled a little bit understanding what tests to take and how to prepare for Casper versus preview. So what are some challenges?
So basically what we've found is that a lot of people aren't really delving into like a 100-day, 200-day, study plan for these exams in the way that you would for MCAT, DAT, or whatever else like that. Again, you probably already have the insights based on your own experiences, your life experiences, professional or employment experiences too. The question is, how did they, how are you able to sort of bring them up, talk about them or chat about them or type about them within the time period allowed? And so what's really important is the interface, the user interface. How comfortable are you with the user interface once you're in exam mode and you're just typing away or choosing your answers or whatever else? I think what we have found is that most people get really more frustrated in that sense, as opposed to the questions themselves. You can ask the Acuity Insights folks and the AAMC PREview folks, whatever their post-test surveys are, they show that examinees have very high satisfaction with the questions. So our survey shows, with a little bit extra time to reflect on that, there's a little bit more dissatisfaction than they are capturing. But again, we're a much smaller sample size than they have. So understand that, there's going to be some frustrating things. It's going to be frustrating even if you don't pass an OSCE later on in your education. So you learn and you hopefully get the feedback that you need to improve.
Yeah, I think that's really important, a really important takeaway and something to kind of wrap up the session. I see that we have no more questions. So I really want to thank you for your time and for hosting this session. I think we learned a lot about situational judgment tests, both the Casper and the preview. So thank you so much, Dr. Chuck. And then the next session for those attendees is making the most of your interview. Thank you again, Dr. Chuck.
Thank you all, everyone who's applying for this upcoming cycle. Good luck to you.